Some childhood illnesses don't just leave scars on the body, they can also leave ideas on the mind. Today, we are talking about malaria, not just as a disease, but as a source of information and fear. Hello, everyone, and welcome to the HealthWise Show. I am your host, Uchenna Amadi. And as always, I will not be doing this alone. With me here in the studio, as usual, are my co-hosts, amazing co-hosts, Dr. Olani Oweye, who will help us break down the medical facts behind malaria and blood group science. And we also have your regular Nigerian, Miss Patsy Wokunga. She's a lawyer and she'll be asking questions that many Nigerians are too shy to ask. Shortly, we'll be hearing a true story from our guests about childhood malaria. Please do not forget to like, subscribe, share, and follow SynLab Nigeria on YouTube and on Spotify. Stay tuned for our guest story.
Growing up in a Lagos neighborhood in Nigeria, a typical Lagos neighborhood where we have a lot of things happening at the same time, I was that child who would always sneak out of my mother's watchful eyes to go into the rain and play and dance, hoping that I have a complete immunity to cold that could be the aftermath. I was also that child that could easily not get knocked off by malaria when it comes knocking. It felt more like malaria stayed in the same block with me. Now, oftentimes with the malaria coming and hitting me so hard, my mother has a routine that she normally do when this happens. She always come with a damp cloth and place it on my forehead, at least to help with the fever. At least the fever I could understand. There is also this concern that comes upon her that she has on her face during those episodes, which she tries as much as she could to hide from me. And there is also this part, the treatment. I know you could guess the treatments already. As a millennial, the treatments was chloroquine. A lot of kids take this chloroquine, or children during about my age took this chloroquine, and they just walk and life goes on. But for me, chloroquine was a nightmare. Just a dose of chloroquine that I could take could almost instantly trigger itching around my body, on my scalp, my nails, all around me, everywhere and nowhere at the same time. It could get so bad that my mom would buy me a Lucozade Boost just to distract me from the scratching and the itching. Now, these seasons were not an interesting one for me because I felt a lot of pain. Now, the fever I could understand, but the itching that comes with the medicine, that I don't understand. It was supposed to help me, but then it turns out to have turned against me like I owed it rent. Now, these interesting seasons for me were not an enjoyable season, even recalling them back now. Now, for me, at about 13, I discovered I was A negative. Now, just to put a good narrative to this, in my with demographic where I grew up in Lagos as a Nigerian, most persons around me were either A positive, AB positive, or B positive, or positive something. And there is me sitting there with an A negative blood group, just like a glitch. I missed every other person. Now, there was one of a time that a friend of mine, who happens to be about the same age as mine, was speaking on me on that. I had to put up a fight, and he went and reported me to my mom. I explained myself. Then my introspective self got me thinking. I was like, so why would I be a negative blood type? I missed all the positives. Then here was the ideology I came up with. It's either this malaria thing has gotten to my blood, that it's affected my blood cells and gave me negative blood. So I was supposed to be A positive, now I'm A negative. So the big question there is, could malaria have affected my blood type as a child? This ideology I had conceived as a child stayed with me for a very long time, or for the longest of time, I would say. Now, the big question I'm posing right now, and I'm still asking that question here, can malaria affect the blood type of a person? Can malaria move a person from being an A positive blood group to an A negative blood group?
Wow. This story is honestly very touching. I really felt for our guest when he was saying that he was always reacting to the chloroquine, and then he was asking questions about will malaria affect his blood group. He was positive, right? Everybody around him were positive, and he thought he was going to. He made his blood group change to negative. That's
That's dramatic.
No, come on.
How is it
No,
dramatic?
in a way, I think we are looking at it like currently. We live in a world where there's much more information than there used to be, right?
Okay.
So, and right now, so many people know about blood group. So many know, it has now become common knowledge to us. So you can look at somebody wondering, like, did malaria change my blood group? And you're like, come on, like, why would you think that? But honestly, take it. You are a medical person. You are even away from this situation. To the normal human being, let's throw back maybe like 20 years. Do you get? Where Google wasn't even around. And then people then didn't even know. A lot of people then probably didn't even know that you could have negative in your blood group when all you hear is O positive. Do you get? How many people knew there was AB self? Do you understand? And then you have this problem. You know your mind can go very far. If you're having a recurring, I had malaria recurring not too long ago, just last year. When something is not something that otherwise should be simple, other people go, they take a drug and they get treated. Then you, every 2 weeks, every 1 month, you now hear that if you have malaria for the next 3 months, you should not fall sick because you treated malaria. But me, I fell sick you start to think, your mind goes into overdrive. Do you understand?
Yeah, so Dr. Ware, so now what is the truth and what is a myth? Can malaria change your genetics? Can it change your blood? Can it change your genotype? Can it damage your liver forever? Is it a sign of spiritual weakness? So what is a myth and what is actually true?
Okay. I would like to talk about the malaria changing, Well, I don't see how that can happen because, you get your blood group from your parents. It's inherited. You understand? So even before the advent of, DNA paternity testing became fully established, we use blood group and genotype to actually, establish relationship. Or at least, because you know that, okay, if you are A and your wife is A, then most likely you're going to have a child that is A, even if you're going to have a divergence O, you understand? So you cannot be A and then have a B. So it can actually enable you to, so basically, what I'm trying
They
to
have gone outside.
Yeah, what I'm actually trying to say is it's something you inherit.
Sure.
You inherit your blood group. So how
malaria
can
come
that
and change
happen?
it?
So it's not possible.
Okay.
There is medicine will be like there's no never in medicine, but from what we know currently, because we know it's something you inherit. You inherit your blood group, you inherit your stuff. So
it
malaria
cannot change your blood group, but it can dry your blood. I used to
do you
hear
mean by
people say
dry?
some people say malaria has dried my blood.
What do you mean by
Funny
dry?
enough, you
Suck
say
the blood
that
dry.
statement now, and it doesn't even
you
sound
need to
strange to
you
me.
need to
Like
explain
it
what you
sounds
mean
like
by
something
dry.
I've heard before.
I'm telling you, I hate
I've
a
heard
lot.
people talk about their blood drying.
Drying.
Okay.
I don't know how you're still walking and you have the grace to speak when your blood is dried.
Maybe that's how people understand it.
But let's
Malaria
just
can
tell them.
actually
Let's
cause-
educate
Yeah,
It can
malaria
cause
can
what?
cause anemia.
anemia,
Oh.
but not like
can make your
drying.
blood level low. But not like
Drying
drying.
the
Drying makes it look as if you have something sucking it,
nothing.
Just
somewhere.
like
But of course,
vampire.
it can actually cause. And how it does that is malaria. There are two places where malaria parasite likes to stay. Depending on the stage, of the parasitic development, the liver, and then the red blood cells. So yes, the red blood cells, like this sexually mature forms, you see most of them inside the red blood cells. So malaria goes into the red blood cell, and of course, when they're in the red blood cell, they're actually foreign stuff in the red blood cell. So when the blood is circulating through the part of the body called the spleen or even the liver, those red blood cells can get broken down. And of course, if you have a high parasite load, then you can have an increased rate of destruction of the red blood cells. And when that happens, of course, you could have anemia. You see that commonly in children.
No,
You see,
not in
you
adults.
see that commonly. And then, of course, some of the malaria medications could actually, of course, there were some that were said to be notorious for that and stuff like that. But of course, these days you don't really get so much of, those kind of medications.
Yeah,
There are
he
some,
mentioned chloroquine.
there are some malaria medications that can actually, I would
Cause
describe them as
adverse
this,
reaction.
like kill and go soldiers. Those
Sorry,
things
what?
that kill and go soldiers. I would call
And
them
wait,
by
they
that.
think they are killing is the malaria parasites.
Yeah, so they are clearing
killing
off
everything in their
the
sites.
parasites, and then the red blood cells also
This
goes
is serious.
along. So basically you have that can happen with malaria treatments with some medications. So I mean, those are the mechanisms by which you can get low blood, not necessarily malaria sucking your blood or something like that.
So you mentioned
So-
liver.
Mhm.
I also hear people saying, if you don't treat malaria, it will damage your liver forever. Hepatitis.
This
So
is
is there any
so new to
relationship
me. Wow.
between the liver and you've said the parasites, but
Yeah.
can it actually damage the liver?
Yeah, the parasite is foreign. So when the parasite resides in the liver,
So if it's
definitely
untreated,
it's going to actually elicit some form of inflammation. Those are big words, but
Yeah.
it's almost like this.
Yeah.
Let
So
me just explain
By
it.
the time you've entered the
Yeah.
inflammation, I'm like,
Yeah, that's what.
I'm like,
That's why
let's
it's
circle back.
Woo,
So I was just trying to explain what
Yes.
what that meant. They would say like everyone now, if someone out of nowhere just comes and slaps you, you're going to have a reaction.
That's like
Yeah.
slapping back
You could
kind of
most
reaction.
times you could actually
Sometimes
slap
you're
back,
just like-
or I mean, yeah. So depending, there's always a reaction to an action.
Mhm.
So when something foreign comes into the body, something that is not,
naturally
natural, to the body,
Yeah.
then the body reacts to it. So that process of reaction, is inflammation, especially the way body reacts to foreign
bodies.
potentially damaging stuffs.
Okay.
Like pathogens.
Yeah.
It could be parasites, it could be viruses, it could be chemical agents, it could even be drugs. You understand? So the body reacts. So the reaction that the body produces against what is foreign and potentially damaging is what is called inflammation. And usually when you get this, what you would get basically would be there will be pain, there will be swelling,
Wow.
there could be loss of function, and then there will be fever. So the fever that you get with malaria fever basically is as a result of, the body reacting to the presence of the parasites.
Okay.
You understand? The parasites eliciting that, and then you have the fever. So when you have a malaria parasite residing, in the liver, of course, the liver is going to react. The inflammatory cells that probably, would react, want to take it out. So then you could actually have, some pains around there. This is more marked, especially in children. You could actually have swelling around that area. You could have, some things resembling some form of, loss of function. When you do your liver enzymes, they could be,
Sure.
here and there. But then again, you could also have some species of malaria parasites that choose to reside in the liver and then stay there
They just-
dormant.
Wow.
Yeah.
So
You
that
have
means it
some
can
forms.
actually damage
Yeah,
your
you have
liver.
some forms, like we call them, hypnozoids, like eating, they stay eating, some stage of the parasite that can just, be in the liver and then, stay eating for a while. Like, the body at that point has tried to actually contain it, to like wall it off, but then it's present and it could actually, be
Causing
potentially
issues
yeah.
there.
So, and then you could also have one of the things you could see, especially in our part of the world, in the tropics, is what we call it, well, I don't know how to explain this, hyperimmune malaria syndrome. When you have this over-exaggeration, of the reaction of the body's immune system. Now, it is the immune system that actually reacts against foreign, potentially damaging
But
stuff.
like doing too
Yeah,
much.
so, it does too much. And what you get as a result of that is markedly enlarged, spleen.
Wow.
And then you can also have enlarged liver.
All this one
Small
from malaria.
mosquito.
All this for malaria. And then you have, I've seen patients with markedly enlarged spleen, on the other side. And then, we've even had to remove, one before because it was so enlarged. And then it was impinging on all parts of the abdomen. It was big, and all that. So you could actually have, some of this. So yes, malaria does actually affect, the liver.
So what of I've also heard one last thing, please. I've heard that malaria can reduce your intelligence.
Who are the people you talk to? I'm worried.
How?
You're worried.
Maybe.
I'm worried about me too.
Yeah, maybe it's because she's like,
Well, maybe if the child malaria in children, childhood. Maybe it's
yeah,
not-
like you can-
yeah,
You see, there is a point.
No. There's no direct causal link.
by that one, I don't know about that brain. No.
There's no direct causal link. Like, okay, malaria.
It has to be. It
But
has to be
because-
severe.
If we want to speculate, extremely
Like you can
speculate.
explain it away from
God.
what malaria does to the body.
Because let's not do too much. We cannot.
And of course, usually you see that in children. And how does that happen? If you have a breakdown of red blood cells, and then you have the product of the breakdown of red blood cells, the bilirubin, crossing into the brain, crossing the
have a
blood-brain
point.
barrier,
I have a
and then
point.
causing some form of cerebral palsy and what. But of course, you probably will see that in children. But it's not like a direct causal link. As a result of the complication of the disease itself.
Okay, so
So
there's still
that's the only thing I can link.
there is a truth in
That's
it.
the only thing
Don't look
and
at me
in that
like don't
case, you just
judge
have
me.
a child with cerebral palsy. So it's not only intelligence that will be affected. If the child would,
Everything.
like mentally,
Everybody they
Yeah,
talk the
some form
one.
of mental
developmental-
Wait,
retardation,
everybody they talk the
developmental
one where they
delays and all
affects
that.
them. That person said
I don't
intelligence.
get it.
Like there's some things I'm just like, how did you come up with that? How did you land
Okay, it's
in
okay.
that conclusion? Wow.
Please, moving on. Let's
Yeah.
talk about the chloroquine
Okay.
that he said he was taking and it was causing a lot of reactions for him. Personally, I do not like the fact that medication is very bitter.
Yeah, but
don't
chloroquine
even
is
know
currently-
why
I know
people
it's
are
not
using
allowed
it
in Nigeria, but it used to be.
now,
I'm not sure
Abi.
when the ban happened,
Okay.
but it's currently banned from being used although it's
Okay.
still used in Nigeria a lot. Funny
Yeah,
enough.
Even after being banned.
Like banned.
Yeah, it's not. Yeah,
We cannot sell it. You cannot dispense. People still use chloroquine.
And
now.
I know.
It's still available.
I know there's still you go to the pharmacy, you buy it now.
Why
So,
though?
But
like,
you can actually shut
people were
down.
using it
They
during
can
the
actually
COVID.
even shut down.
People were using during the
hospitals because
COVID
of it.
era.
For
People were
I
using
think
during the
I'm
COVID
not
era.
now. I'm
Wow.
not very precise on what the ban is, but I think it's most likely. Please don't quote me. Check. Fact
people
check.
still use-
But I think it's banned for the treatment of malaria currently.
Well, I don't.
Why should somebody even
Because
take? It's
of-
not the same thing
because
that
it-
you will
yeah,
get
I-
whether you're treating malaria or not.
It's
not the same reaction.
It's shown. Like
If I'm
chloroquine.
thinking-
More people tend to react to chloroquine than they don't. Do you understand? It's not
Okay.
everybody that reacts, but the amount of people that are potentially likely to react to chloroquine
I
are a
feel-
lot.
I feel if it's been banned, then it shouldn't be available over the counter. It should
But
For
be-
any
the
other
question
thing,
is-
for any other
I mean,
thing.
because
The issue is
chloroquine
now
have other
regulation
uses.
because
Mhm.
once they were able to establish that there were safer treatments for malaria, so it's
Yeah.
like, we don't have to use this one that's giving us
I think
this
the
amount
issue
of
would
issue.
be the issue of resistance. Because people those days when we were growing up, it was like the wonder drug, which
Okay.
I passionately hated because had a lot of reactions to it. But then we were always being whisked off, sometimes shipped off to go get chloroquine injections and whatnot. But then I feel the issue basically was resistance. Malaria parasites, it wasn't really being very effective for treatment.
Funny
as
enough,
it
I think
should
I've
be.
heard that even up till now, like when it comes to effectiveness of malaria drugs, like chloroquine is still.
Well, that's because
chloroquine.
everybody stayed off it for years, and then we started using artemisinin-based
Yes.
medications.
I would
And
rather
the
do
issue
that,
with these
though.
things is malaria is resistance, and of course, we've been using artemisinin-based completion therapy for years now. So
And
I
it's
think
no
it's
one
even
is
because-
really
and there are no
using-
side effects except
that's
Yeah.
the thing.
And-
some of them.
and-
Some of them might
some
make
of
you
them
drowsy.
have,
Yeah,
I don't know,
and no
break
one
you
is
down,
really-
no side effects
and
to
some
that
people
one.
are beginning to
But you're
develop.
not
No.
itching
Yeah,
though,
people,
like
listen,
chloroquine.
people are also beginning to develop resistance to
So, yes.
artemisinin-based. So
Which
in
is
such
something-
persons, then you may want to actually revert back to chloroquine. You understand? So, but then for me, the issue with chloroquine is, it has a long list of side effects, and of course the common ones would be nausea, vomiting. It's very bitter. Nausea, vomiting, dizziness, and what have you. But then in some folks, it could cause skin itching, like
that's
I
the
have
one
heard
I've
of that.
heard of.
It could also cause some blurriness in vision. And in people who are actually prone to heart stuffs, it can actually
Wow.
cause some abdominal heart rhythms.
That's
You know,
a lot,
it can actually do that.
You
But
see
you
why
know,
they
but,
banned
you
it?
know, no.
So I think it should
I
stay
think I have
banned,
issues with
though.
that band.
I think it should stay
I have
banned.
issues with that band. I'm not.
If
I don't
they
know.
really
I'm
ban
not,
it.
like I said, I'm not
It's
very
still
sure
very
about
available,
the parameters of the ban. Do you get?
Okay.
Because sometimes a drug might be banned to a certain extent. Do you understand? Like, oh, it's not an over-the-counter medication anymore. Sometimes it may be banned for this, like for treatment of specific things, or it might be banned except you've established that this one has reached. Do you understand? It's the way there are some pain medication that cannot be over the counter, things like that. So I'm not sure what the parameter, but I know chloroquine is not supposed
Yeah,
I
I think
digress.
it's
it is not
the issue- I
supposed
think
to be
it's the issue of
sold,
that
and it's not supposed to
resistance.
be administered. In fact, if they come to your pharmacy or hospital and you have chloroquine installed, it can be penalized.
Oh, that's.
I have a
that's-
question. I want to
I
digress
mean,
a
that's
bit.
anyone. Like,
I have to
so
digress
you
a bit
could be
for.
penalized. Wow. That's please let people at the back help. All those people at the primary. I mean,
Dr.
health
Way, I
centers
have
and
a
all
question for you.
that. Okay, please.
Because if our guest is coming, our guest is a typical, just a normal Nigerian, let me put it that way, an average Nigerian. If our guest is saying or asking the question that, is it that the malaria changed my blood group? It's a problem. Why I say, I know you've stated, you've cleared our doubt that it cannot alter our genetics, but my question now is, why would somebody think that way? Are we failing at health education? Or are people simply not interested, until they become victims? Why would somebody have that kind of prefixed mindset that, oh, I've been having recurring malaria, so it must have changed my blood group? It's, if somebody is sharing this story, how much
much
more
we're not
other
hearing.
people who we have not even heard their story? So
I think
why are we failing?
no,
in
I
health
think there's a
education?
failure in health education, but I don't know if it's well, at the end of the day it will be a failure. But also, don't just, I think you can't afford to underestimate just how far the human mind can go. Do you get in speculations? And in
Is this not
in
Okay.
our society, we
Yeah.
already have a tendency to be very
we are
paranoid?
we are myth-loving people.
we are myth-loving
Yes,
people. Do you get?
Yeah.
So, given that you are already conditioned for your mind, before you know it, you are thinking, what can I link it to? If this thing is not going, do you understand? Then you now hear that you are the only one with a specific kind of blood group. And there's always I've never really understood people, but this is a me thing, because anytime I find out that I deviate from the norm, do you understand? My brain is hardwired to think that I'm suddenly special, not that I'm the opposite. I've never really understood why somebody find out if everybody is what they call it, O positive, and I find out I'm O negative. I have a superpower now.
Really?
That's how I'm always thought like that when I was a child. So I became very what's the word? It's very interesting to find out that when people find out that they are the exception, their first thing, it's like, why am I so weird? What's wrong with me? But more people reacted that way. Do you get? So
Yeah.
I think that contributed a lot to this particular
To the
situation.
mindset, okay.
To the fact that he had heard of A positive, everybody was A positive, O positive, do you get? And he turned out to be A negative. He's like, why am I the only one
That is different.
that is
That is
different?
different.
Yeah.
And once you find that differential, like you want to link it to something,
something
what caused
recurring.
it? Do you get?
Yeah.
So it's like, okay, I have this problem, and this second one seems like a problem. What if
They are together.
both of them are related?
I actually I quite agree with Patsy on that, because I was going to say that what must have informed that mindset would basically be as a result of the fact that everyone around him, probably his family, they're all positive, and
And
then
they may not even be having the
he's-
same
yes.
malaria often.
he's
like
negative and he's been having malaria. So probably we just as she said, link like, oh, it must have been the
Yeah.
recurrence. But however, this also brings out a very important issue. I'm sure and I want to address this. A whole lot of times in this part of the world, we don't actually test for these things that people should know, like your blood group, your genotype, early.
Yeah.
Not until you probably need to.
Don't they
So
test for
if-
blood group when a baby is born?
It depends on the
if
parents.
yeah, no, except if probably the baby needs a transfusion, baby has
medical.
most
Otherwise,
of the
just
times
it's
it's
not.
not routinely done.
I thought it was a routine.
No, it's not routinely done. So in this kind of situation, if he had his blood group done early enough before he started having recurrent malaria, it would have
had this
cleared all the
mindset.
doubts.
Yeah.
You understand? So
Yeah.
again, this underlines the fact that, of course, this thing should be done early. People should know early, people should know on time, and people should verify blood groups because this thing is inherited.
Dr.
Then-
Wei.
yeah.
Okay, please.
Yeah, then of course, he may also be thinking that, oh, fine, if perhaps everyone in the family is A positive, maybe A positive, and then you have a child that is A negative, there's always that tendency to feel, because normally an average person will feel, okay, everybody is positive, and your father is positive, everybody. So, I mean, what kind
Why
of
me?
child are you?
Yeah.
So it's very, very easy to actually pinch into something that has been, recurrent. Nobody wants to think, because I'm sure the thing that they must have thought about that wasn't said was, oh, I hope,
Yeah, not different from
you're not different from us
Where did you
genetically.
come from?
Where did you come from, and things like that.
Yeah,
But then again, I want to say that it's actually possible rather,
Okay.
for positive parents to actually have a negative child.
Okay.
Please say
possible.
so. You
It's
could hear
possible.
that one.
I want.
It's possible.
I liked how you emphasized on the recurring malaria. So speaking on that repeated malaria in childhood, so if a child gets malaria repeatedly, is it normal, or is it an evidence of neglect from the parents? Should parents be held accountable? I don't know. Do you understand what I mean? If every like you've treated the child, is it that the parents are the ones neglecting the child? They are not protecting the child enough from mosquito bites. Do you understand what I mean?
well-
Because I'm struggling to understand why the malaria keeps recurring. Because I believe people know what to do now.
Yeah, but
They have
when now, what do they
insecticides.
call it?
They have the nets.
I think, like, for people who live in Nigeria like us, right? How like, sometimes it feels like it could feel like no matter what you do,
get
mosquito must just
malaria.
enter.
like, mosquito is everywhere. It's looking for you.
Who
Do you
to
understand?
devour.
How I'm not gonna. At some point, I began to even think about, like, what's the point? All this insecticide, you will finish spraying insecticide.
One will survive.
Yeah, do you understand?
And
Next
comes
thing
your
it will
ear.
just pass you.
Your ear.
Okay, I was actually going to say this.
Can
It's
you
a
blame
combination
anybody?
it's actually a combination of factors. Now, children are more prone to getting malaria, especially children less than 5, because of their immune system. It's still in the development stage. So they are more prone to malaria. Malaria being endemic, just like you said, in this part of the world, so the more often than not, or more frequently than adults, they get malaria, more than adults, get malaria because of that. Then I said it's a combination of factors. One, prevention, they say, is better than cure. So what parents and caregivers should pay a whole lot of attention to making sure that children are protected, from malaria, where especially in seasons where you have malaria occurring more during the wet months, because the female Anopheles mosquito that carries the parasite, loves puddles of water and stuff like that. So it loves the temperature. The temperature around that period is optimal for its breeding. So you find malaria occurring more during the cold months, the wet months, during the wet season. So protective clothing for children, and actually ensure that you have nets around your house, the doors and everything. Make sure, and of course the mosquito also likes dark places. So when you have bushes around your house, where you have loads in the house and everywhere is, so you need to pay a lot more attention to decluttering, to clearing all the drains, and also use of insecticides and sprays. I know there are some insecticides and sprays. Insecticides and sprays don't usually appear to work well against mosquitoes these days, because of course they also want to survive. So
one ammo.
with each generation they also want to survive. So they actually also, in their own genetic mechanism, trying to develop
evolving.
resistance.
Because
they are evolving.
the
They're trying to
insecticide has to
develop-
work when we're young.
It's not working.
So trying to develop resistance against insecticides, trying to develop resistance against anti-malaria medication, so that their own offspring, might also, survive. But the beautiful thing again about, malaria, especially the artemisinin-based medications that we tend to overuse because there's a lot of overdiagnosis of malaria.
I'm coming there.
You find out that the drug itself, even when you take it when you don't really need the medication, it has the ability to actually make the malaria parasites, even when it's still in your blood group, not very effective as it should. Then against the insecticide spray, there are some insecticide sprays that the effect still lingers on, even on your wall, when you use them, even like hours after you've actually used them. But the major challenge is actually getting the right kind of insecticide spray that would actually work for you. But then we still have to be very big on prevention, especially for children. Clothes, well clothed, especially during those months. Decluttering, cleaning of our drains, use of insecticide sprays, and whatnot, mosquito repellents. And whenever they have symptoms, which what they would usually have is fever and loss of appetite, then it's better for us to actually take them to see the doctor and not just assume and then start, because malaria in children can become very complicated. So you actually don't want to take chances, with them. So I feel it's not just the parents. And sometimes you have medications that, God help us. I've been hearing of stories of not very effective drugs in the Nigerian market these days. Then you have drugs that are not very effective as they should. I could remember discussing with one pediatrician and actually expressed concerns about, some of the antibiotics and anti-malarials that he's been using, that they seem not to actually be working, for the child. In fact, there was a time he had to tell me that for some particular antibiotic, he had to increase the dose by like 25% for the child.
Wow.
Before, things like that. So you begin to see that also. So sometimes
that's why you see failure of
so
regulation.
sometimes that's why I said it's a couple. It's like, so you have, it's not just the parent, it's not just that factor alone. There's a whole lot of factors
So
that
let me
contributing to the recurrence of malaria nowadays.
Let me stay on the treatment culture a bit. So why do people, Nigerians were powerful people, why do people treat malaria without testing and then complain when the drugs do not work? Yes. So again, is this self-medication killing us more than the malaria itself? Because the abuse is massive.
Yeah. No, I think we actually talked a little bit about this in one of our podcasts.
They should go and watch.
Yes, go and watch the podcast on malaria testing.
But honestly, the issue is there is overdiagnosis of malaria in Nigeria.
It's bad.
And because malaria has non-specific symptoms, there are 1,000,001 things that could actually cause fever, not just malaria. So, and because malaria is very common, is endemic, in these parts. And of course, because we know that, again, one of the things about it is because we know that a lot of people will just go treat malaria when they get mosquito bites. That also actually informs that. Because mosquitoes...
2 days they will go and treat malaria. Which has mosquito bites?
Doctor, wait, raise them.
People do that.
Let them hear it.
Because see the mosquito bites.
The moment they see, I'm telling you, after I ask me who am I speaking to, not them.
They will say it's prevention.
One thing we should know is
what if the mosquito that beat them is not the female and also
I
this
was
mosquito?
going to say that. It's not all mosquitoes.
You just see that thing, you go and
transmit,
buy.
But then there's so many things we actually need to educate people about. It's only the female Anopheles mosquito
they don't know that. I don't even think that people. I think right now people are not even giving their bodies a chance. Do you understand? Like when
even get the malaria,
not even get the malaria. I believe in giving your body a chance to fight things off. Do you understand? The fact that a mosquito beats you does not mean that you're going to get malaria. Your body might deal with it.
There is even a life cycle before it will be made manifest.
So I do believe, I think it's actually some part of education that's helped me to realize that there are certain things that your body can deal with on its own. Do you get?
Yeah.
Just give it a fighting chance. You have white blood cells like trying to do what they are supposed to do and all of that.
I like when you talk like that. You're trying to do what they're supposed to do. White blood cells.
They're trying to
Speaking like
Please do
not
not,
a doctor.
do not kill me. I don't
they're trying to do their
let them do
work.
their thing, you know.
They give them a chance, but so if you just think, because right now I even talked to my body was hot yesterday and I had headache. I'm already swallowing, and I'm like, who told you?
So no, we have some very bad practices, or what should I call it? Because it has become a way of life. Bad cultural practices. Now, let me state here that it's only the female Anopheles mosquito that has ability to transmit malaria, that acts as a vector. And it is only when the female Anopheles mosquito takes a blood meal from an infected person
And passes the parasite
and
back.
passes the parasite. You understand? Then again, one thing we know about mosquitoes, I could remember one of my lectures in medical school. Lecturer said mosquitoes are anthropophilic. I mean, they love people. Wherever you see plenty people, you actually
Yeah.
get to see lots of mosquitoes. So, and then he
They're
was trying to
social.
link the overpopulation to that, and the fact that Lagos, where you have
Oh,
1,000,001
wow.
persons, people
Wow.
trying to, So mosquitoes. A whole lot of times that's what happens. Mosquitoes, my children have been playing outside for a while and they must have gotten mosquito bites, or there are mosquitoes
they're
in this
just
house.
assuming.
Yeah, there are
Just-
mosquitoes in this house and all that. And so any slight fever,
Wait, so to it sounds like I didn't know that there was this sect of people that are using malaria treatment like
Yes.
multivitamin,
yes,
because that's what it sounded like.
yes. It's like motherhood starter pack.
No, because
Like
the
you
one
would
I
have
know,
vitamin C.
the one I know is when you
Abidec,
start having
Pyron-
symptoms
all
and you
those
self-diagnose.
paracetamol,
Do you understand? But then what
Flagyl.
I'm hearing from people,
Oh,
people are using
no.
like multivitamin, this kind.
starter pack.
Let's just inject you.
Starter pack in every home.
Do you know the funny part? When you were talking about the female Anopheles, somebody will now be asking, how we know now when that female Anopheles mosquito beats
wait,
us?
until
You
you-
cannot know until you go and test.
No,
and
wait,
be
wait.
positive for malaria before you start treating. Please.
The context is this. What I'm just trying to say is,
Yeah.
of course, I'm not saying you should go and be checking for female, The
When you
context
start to
is
feel-
not all mosquito bites lead to
So that
malaria.
you know that.
Not all
That's the
fever
basic.
is
Is
malaria.
Thank you.
Because when you keep using medications you don't need, they are actually inviting resistance. So when you
When you
eventually
actually have
need
it,
the medication,
it
it
won't
might
work.
not work for you. So it's very, very important for
But
you
I
to
think
yeah.
we need to
So if you have a fever,
Hmm.
you could use paracetamol.
Mhm.
If the fever is not subsiding in 24, 48 hours, go to the doctor.
hospital.
Okay, so I
And
think,
malaria fever has a pattern.
yeah, I was going to mention that, but also I feel like we can't do this without essentially weighing in poverty. We are a poor country.
Okay.
We are getting rich. I
oh
believe
my
in
God.
Nigeria.
Developing.
But like I think that this it contributes to the issue. People are trying to avoid incidental costs. Do you understand? If I'm going to pay extra for malaria treatment, I might as well just swallow the drug. I know where we are going. Do you understand?
Yeah, that's a very
A
valid
wrong-
point.
but the wrong
actually
mindset.
said.
It's
But
a
then
wrong mindset.
malaria
yeah,
treatment is
but-
not expensive.
That's-
WHO recommends the RDT.
To you, Abby.
I mean,
I not see my eye.
That's what to you. Malaria treatment is not
no.
expensive.
You can actually go to any primary health center,
And that's
very
for
good
free.
pharmacy. They
Well-
do
The
they test for
testing.
RDT. Yes.
Okay.
Me, self, I didn't even know.
There's
that
almost every primary health center in Nigeria does
For free.
RDT.
For free.
Okay.
And I know there's some
For
certain
free,
states that
for
for
free,
women,
for
for pregnant
free.
women and children under 5, it's free.
So as I'm not under 5, because sometimes that extra 1,005.
So and then okay.
I know that at the
know-
end of the day, it's like it's your health, right?
No. Let me even bring this.
I'm trying to
let me
be
even
as
bring- Let me even
realistic
bring
as
this
possible,
context
right?
to it. Okay, you are going out to go buy malaria medication. You feel you actually have malaria, and then you go over the counter, you purchase it, because of course there are malaria medications have varying prices. So the person that cannot actually afford the RDT will probably go for the cheapest, and most likely the cheapest might not even be very effective for him or her. So at the end of the day, you might actually find out that it's been penny-wise, pound foolish
food.
kind
Yeah, I
of
know.
situation. So I
It's a
feel
lot of penny wise pound.
doing the
Some
right
people are even
thing-
finishing other people's malaria
yeah,
medication.
doing,
Yeah.
Oh, you don't
doing,
know.
doing the right.
Oh,
Party.
they've never. No,
Doing
to
the
be
right
honest, my friend
thing.
has told me before. Oh, you're having malaria. I didn't finish my last medication. Maybe you use that
So
one.
now I
That's
can
even
ask
bad.
who are the people you are friends
You're not
with,
even, you're not even completing your medication. That's even wrong.
and they're remaining for you.
Yeah. So there's a whole lot of stuff that we're doing. that
So
is
wait,
not right.
wait. So if we continue like this, we'll not leave here.
Oh, frankly.
So I will just ask Patsy your final words on this episode. After Dr.
I
Wei will
do
give
think
you.
that people should. I think we need to have more health education, and I'm not even saying like, oh, doctors help, but you as a person, do you get? Because when he was talking during the story and saying that he was trying to make that connection between malaria and his blood group, in my mind I was like, wasn't there any doctor around you that you could have just asked a question? Do you understand? So I feel like we as an individual like take more proactive steps. Today I'm not going to say please though they disadvise you from Googling your symptoms, but a simple thing like, oh, can malaria affect my blood group? I think that's something even the internet can tell you no to. But I think speak with more healthcare professionals.
Sure.
Leverage more healthcare platforms that give you good information about your health, right? And I think people should also stop playing down their health. We just discussed, about self-diagnosis. Just be, I think for every little thing that concerns your health, see it as a life and death situation. Headache,
I like
fever,
that. Yeah.
anything. Let it just be in your head. Let it just be translating to you like this thing can kill me. Do you get? And then I think once you do that, you would be able to approach it with that level of severity. And you're not just going to be like, oh, it's just malaria. Let me just go and buy
Level of
drugs. Do you get?
seriousness.
You need to take it with seriousness. So if it's like, oh, I think I'm having a fever, go and get tested. Any drug that you're going to swallow, including Panadol, take it with a level of serious. Like, this is something that, as much as it was done in a lab, it was tested, rolled out to say it's been, everything has side effects. So realize that anything you take is potentially going to alter your system. So be serious about, don't just take it anyhow.
Okay. Thank you very much, Dr. Wei. Any last words so we can?
I don't really think we should.
This one you're sitting up.
It's serious.
Discussions about malaria, I don't really think it would end anytime soon. Yeah, because it is the biggest killer of children under 5 in sub-Saharan Africa. So it's something that I feel everyone should take with the utmost level of seriousness. You understand? So I'm not really going to overflog some of the issues that Patsy had raised, but the truth of the matter is, I would say this, my parting words would be, not every fever is malaria, and not every mosquito bite lead to malaria. And whenever you are being treated for malaria, make sure you complete your medications. So no half measures. And make sure you go for testing before you start malaria treatment. So those are my final words.
Thank you very much. So there you have it. Malaria is serious, but misinformation is also dangerous. So instead of building theories, build prevention. Go to the hospital. Treat. Protect yourself. Treat and stop guessing. My sincere thanks to our guests, Patsy, my hosts rather, co-host, Patsy and Dr. Wei. And also our guest who shared his story. It's actually very, very informative, and it has brought out a lot of lessons for us to take home. Please do not forget to like, subscribe, share, and follow SynLab across all social media platforms. My name is Uche Namadi, and this is me signing off.